Hello, my name is Tammy Sartor and I am a general surgeon. I chose to go into healthcare after I watched a television show in 1970 called Lifeline. Lifeline was a public broadcasting show that demonstrated people who were in medicine, and the man I remember the most was Red Duke. He had an amazing story to tell, and from that day forward, I knew I wanted to be as much like him as possible. I went into general surgery because the very first day of my surgery rotation in medical school, even though I had to be in the hospital at 4 a.m., I loved it from that point forward. What I think is important when a patient comes to see a physician is that they are able to establish a rapport where questions can be asked and answered completely. It is especially important in surgery because what we do is so invasive that patients need to understand exactly what the plan is, how it will be executed, and what they should expect afterwards. For my patients, all of my appointments are at least a half an hour, and we spend plenty of time discussing options and what their goals are. I like surgery because I get a sense of instant gratification, especially when a procedure has gone very well and I know that the patient's health is going to be improved. I think sometimes, especially surgery patients, are reluctant to ask their physicians about their own experiences, how many cases they've done of that type, what the outcomes are. But I think patients should ask those types of questions, and physicians should be able to answer them in a very straightforward manner.